Hello everyone. So the second type of morphological classification is yeast-like budding. Example of yeast-like budding is Candida. So there are 20 species of Candida, but the most commonest causing human infections is Candida albicans. So the other species are Candida glabrata, Candida tropicalis. So we are going to study about Candida albicans. So Candida albicans, it's the most commonest human infection causing fungi, and its morphology is more than 1 micrometer. It measures 3 to 5 micrometers, and its shape is oval or spherical. It produces pseudo hyphae, and when we do gram staining or KOH mount, it shows gram positive. So whereas in Cryptococcus neoformans, it is having prominent capsule. So Candida is producing pseudo hyphae. So try to compare so that you can remember well. And yeah, coming to the pathogenesis, it is an opportunistic endogenous infection. So we have seen in Cryptococcus neoformans, it's a soil saprophyte, but this Candida albicans present as a normal flora on the skin, GIT, oral cavity and vagina. So the pathogenesis is in predisposing factors like immunocompromised patients. It acts as opportunistic infection. It causes opportunistic infection. It is a normal flora, but when there is a decrease in immunity, it is causing infection. So like HIV, diabetic, cancer, in malignancy, and in intravenous catheter, in still when patient is on steroids, and pregnancy and newborn and old age. So these are all immunocompromised in immunocompromised patients. So you can see this Candida albicans as the most common causing infection. So coming to the lesions, it causes mucocutaneous infection, chronic mucocutaneous infection, and skin and nail infection, and systemic infection candidiasis. So we are seeing here skin and nail infection, whereas in Cryptococcus neoformans we have seen it as asymptomatic. We said deep mycosis, but here we can even see symptomatic. So the mucocutaneous, the first one is oral thrush, and it causes vulvovaginitis, conjunctivitis and keratitis. And the chronic mucocutaneous candidiasis is in immunodeficiencies and fatal infection. And skin and nail infection, we can see infection in axillae, groin, perineum and submammary folds. And in infants we see napkin rashes. And the nail infection is paronychia and onychia. And systemic candidiasis it causes is meningitis, endocarditis, and pulmonary infection, intestinal candidiasis, UTI and septicemia. So next we will see the lab diagnosis. So as we are saying, we collect a specimen like skin infection, we collect lesions of the skin, and obviously nail when there is an infection like paronychia and onychia and mucous membranes. When it comes to the systemic infection, yeah, so go through the notes. So this is the morphology and species I have mentioned over here, and this is the pathogenesis. So go through the predisposing factors as I told. So mucocutaneous infection, chronic mucocutaneous candidiasis, skin and nail infection, and systemic candidiasis. So again, in mucocutaneous infection, you can see oral thrush, vulvovaginitis, conjunctivitis, and keratitis. Chronic mucocutaneous candidiasis in human immunodeficiencies and fatal infection. And skin and nail infection in infection of axillae, groin, perineum, and submammary folds. Whereas nail infection, paronychia and onychia. And systemic candidiasis, meningitis, endocarditis, intestinal candidiasis, urinary tract infection, and septicemia. So next we will see lab diagnosis. Lab diagnosis. So the specimen we take is lesions of skin, nail, and mucous membrane. So direct microscopy we do here is gram staining and KOH. Whereas we have done in Indian ink preparation for Cryptococcus neoformans. Here to see the prominent polysaccharide capsule. But here we are doing KOH mount and gram staining. It shows gram positive and it shows a pseudo hyphae. And this pseudo hyphae indicates the colonization and tissue invasion. The presence of this pseudo hyphae indicates colonization and tissue invasion. So yeah, it shows 3 to 5 micrometers and pseudo hyphae. Yeah. And then coming to the culture, on Seborrhoea's dextrose agar at 25 to 37 degrees centigrade within 24 hours, it shows smooth creamy pasty colonies, whereas we have seen smooth mucoid colonies in Cryptococcus neoformans. Here we are seeing smooth creamy pasty colonies. And yeah, when we do gram staining, it shows budding yeast cell. And on blood agar, it shows white foot-like extensions within 24 to 48 hours. So yeah, next we do is to differentiate from Candida albicans to other species of Candida. We do germ tube test and we see chlamydospores and also carbohydrate and fermentation and assimilation test. So in germ tube test we do, when we incubate these specimen with serum within 24 hours at 37 degrees centigrade, it shows germ tubes, and this is called Reynolds Broad phenomenon. So this phenomenon, Reynolds Broad phenomenon, can be asked as a short note. So Candida albicans, to differentiate from other species, what we are doing, the specimen we are incubating in human serum. So it shows germ tubes. So go through the notes, you can see the germ tubes and chlamydospores on cornmeal agar, and it is called nutritional deficient agar at 20 degrees centigrade. At the end of the budding cells, you can see chlamydospores. So, and carbohydrate fermentation and assimilation test is done to differentiate from these Candida albicans and from other species. And the serological test like precipitation test we do is counter-immuno electrophoresis, and antigen detection we do ELISA, and skin test it shows universal positive. So and yeah, the treatment is topical application, clotrimazole and miconazole. So even you can write this. So yeah, go through the notes. I am going to give lab diagnosis too. And yeah, we have done Cryptococcus neoformans and we have done with Candida albicans. And I told you Reynolds Broad phenomenon as a short note. So make a note of that. And next we are going to see is uh, molds. The third type of classification is molds. So go through the notes, compare, and go through the notes, and for preparation for exam you have to revise every day, then only you can remember, because we have to read mycology, parasitology, bacteriology, virology. All these we have to, end of the day, we have to carry everything and write. So go through the notes every day and revise what I am telling every day, so that you can remember well and try to compare as I said. Yeah, I hope you all understand. And I'm coming up with the next topic is molds. Thank you.